because we only have an hour. So welcome to our weekly COVID tips. This is our third week that we've been doing these sessions, and our cases for COVID-19 in Arizona do continue to trend downward, which is really, really good news. We have had almost 835,000 cases since the pandemic began. And as you know, this week marks a lot of the year anniversary of the emergency declaration, of the governor's stay home, stay connected order, and lots of other things. So we also have sadly had 16,645 people lose their lives to COVID-19 since the pandemic began. Most of those in the last few quarters as things really started spreading. And with a lot of hope in our hearts, and thanks to all of you who've been immunizing, our state has administered 2,691,000-ish vaccines, and we're getting thousands more a day. So we know that the more vaccines we get in arms, the lower our cases can fall, and the lower our death rates are going to fall. So our job at these trainings is to just support you to get as many shots into as many arms as you possibly can, especially as supply, as we expect it to increase throughout the country and in Arizona. So we are still hearing that in another 3 or 4 weeks, things in terms of vaccine supply should look really different, which gives us a lot of hope. We think we'll have a lot more doses, and a lot more of you who aren't administering yet will start administering. So today we are going to do like a really brief recap of last week, just for a couple minutes. And then we're going to do the same thing we did last week, where for the first 15 minutes or so, you can ask those immediate kind of front of mind questions, things that you really want to get answered before your next patient walks in or before you host your event, next event tomorrow. We do ask that you not ask any ASIIS questions during that time, and that's because Maggie Macias from the Department of Health, who is our ASIIS expert, she is going to be able to log on at the latter half of this, the time we have today, and she will be able to answer any of those ASIIS questions. And we will keep the line open for 15 minutes again to continue asking those kind of specific ASIIS questions. So. But our big presentation today is storage and handling, and we are lucky to have Macrina Leach, the nurse program manager at Maricopa County, talk about that. You want to say hi, Macrina? Oh, you're on mute. That's why we practice this.
Hi, Macrina. No, hi, Macrina. Hi, everyone.
Macrina has administered many, many COVID doses and just general vaccine doses to people of all ages, shapes, and sizes over the years. So she'll be able to answer all your questions specific about the vaccine presentations that you're working with in your settings. So, and then we'll have Q&A. Okay, so brief recap. The big thing that we heard at our first training was from especially primary care offices who want to know, when can I get vaccine? Especially those of you in Pima and Maricopa County. So in Pima County, they are not distributing vaccine to primary care offices yet because of the supply challenges. In Maricopa County, whoever is noted as your ASIIS primary contact, that's the email address that you did when you did your onboarding process, they were emailed a link of a provider request form where they can you can submit requests for vaccine right now. Many of you have probably done that. If you got denied, you are not alone. There is just major supply issues still, and a lot of primary care offices are not getting those requests approved yet because of the supply challenges. So just know that as both Maricopa, Pima, and other counties, as they get more supply, their plans are to bring in more primary care offices so that you can also make sure to be administering that vaccine. So a couple more weeks, we hope that looks a lot better. So the other thing last week that we learned is that data loggers are on back order. So you do need to have one of those to be able to accept vaccine. ADHS does have some data loggers, and you can email that email address to see if they can, you can get one from them. They have no docking stations. So if you don't have a docking station, you what we're recommending is that you contact another office to see if you would be able to borrow theirs when you get vaccine. And Macrina, what is for those, a lot of the folks who are signing on are kind of new to vaccine. So why do they need the docking stations?
So you need the docking station to upload your information into your computer and into ASIIS, so you can continue to order vaccines. So a data logger is great, but you have absolutely no way of sending that information to ADHS without the docking station. So if providers want to loan each other docking stations, that's a possibility.
Okay. All right. And remember, right now, no one is requesting vaccine through ASIIS. We're all requesting vaccine through the counties. Unless you're a pharmacy or an FQHC, you have a process to request vaccine from the feds as well. So just as a reminder. So a couple other things that have changed this week. A few days before you get your shipments, you get those ancillary kits to be able to administer vaccine. Those should have your immunization cards that you give to patients, and you write their name and the lot number and when they got that dose. But we do hear sometimes that the ancillary kits did not come with the immunization cards. So if you need immunization cards, please email tappyadmin@tappy.org. We will make sure that the office is onboarded and activated and be able to print one for you or send you a template to print. The big news this week was that CMS updated their payment to $40 per dose. So when you complete that series for a patient, you will get $80. And Access did publish that this week. I think Jennifer's, if she didn't already, is digging around for that link. Another change was around who can administer vaccine, COVID-19 vaccine, this pandemic vaccine. So doctors, nurse practitioners, nurses, and MAs can administer vaccine. Per Medicare, MAs can give shots without direct supervision as long as that doc is available for video call. That is no different than all of your other vaccines and how your standing orders are written now. No changes there. Pharmacy techs can administer vaccine under the direct supervision of a licensed pharmacist. Interns also still need direct supervision from a pharmacist. And dentists and vets can now also administer COVID-19 vaccine during the pandemic. They won't be doing that in their office. So when you're getting your dog's teeth cleaned, you won't also be able to get a poke, but they can now volunteer at our community pods, which is great because it's more vaccinators that we can use. So. And I think that's all for our general updates of things that have changed since last time we met. So I want to just open it up and what are your front of mind questions not having to do with ASIIS? We did get one too, Macrina, that was sent in on that evaluation that I wonder if you can answer. So if we are not billing for vaccines and registering patients outside the state website, what information does our site need to keep in our records? And you're on mute.
So all you would need to keep in your records are what you would routinely keep in your records for vaccine administration. The manufacturer of the vaccine, lot number, expiration date, and that would just need each to be associated with a patient, but that should be all the information you need to keep.
All right. Anybody else have questions? And there's a clarification in there. Not all, from Angela, not all data logger brands are on back order. ADHS ones ordered are on back order. So if a provider wants to order their own, they can. If they want to request from ADHS, they do so when completing the onboard forms. And we will get some, and when they get it, they'll ship them to them. So thanks for that. I have another chat in here about who can administer. Yes, EMTs and paramedics can also administer vaccines. So thanks for reminding. We need to update that slide. Anybody else have things? Oh, the process to volunteer. We will actually, when Macrina starts talking about storage, I'll try to find that link, but we'll make sure to email it out too for how to enroll in volunteering. For your medical folks, Becky, that want to volunteer to administer vaccines, there's a quicker process for them to get approved. So we'll make sure to provide that link too. And you should all contact your counties because everybody will have a different system about enrolling. So we'll make sure to give you at least Maricopa County, whatever other county ones that we can get quickly, and the state. And Jen, what's the billing code for Medicare patients and non-Medicare?
Yeah, I was just looking that up. So this is different. The billing codes for this vaccine are different. So each billing code is vaccine specific. So you have a vaccine code for J&J, for Moderna, and for Pfizer. And then you have separate administration codes for first dose and second dose per vaccine. So right now, I think we have 11 codes. I put in the chat a link to a billing guide that has all of the codes. You use the same codes for Medicare and non-Medicare. And the link that I sent you has a guide that includes the CMS rate, the access rate, and then the regional adjusted rate for Arizona, which is typically what the private plans look for.
Thanks. Anybody else have stuff that's stumping you this week? All right, well, we'll move right along, and again, Maggie will log on to answer some ASIIS things. So any ASIIS questions that you have. So Macrina, take it away. Tell us about the cold chain.
Oh, I'm going to try to make this be really exciting, okay? So the cold chain, this is just the process by which vaccine needs to be handled at proper temperatures throughout the entire process. So it actually starts at the manufacturing where they maintain that cold storage. And then it goes to vaccine distribution. And so that's the manufacturer and distributor's responsibility. Both Janssen and Moderna vaccines are being shipped through the routine VFC, VFA shipping process through McKesson. So these guys are really, they know what they're doing. It's their business. They've been doing it a really long time. Places like UPS and FedEx, they even fall within that cold chain responsibility. But when it shows up on your site, and when you document that the temperature is maintained and that it's appropriate temperature on delivery, then that responsibility moves to you. So you need to unpack it in a timely manner, verify that it was sent to you at proper temperature, move it into the appropriate cold storage unit, whether it's refrigerator or freezer. And then you need to make sure that you maintain that cold chain through prepping the vaccine and administering the vaccine. So everyone plays a little role in this process. And staff training, everyone should be trained. Your front office staff, those that make appointments and greet your patients, they need to know what to do when a delivery shows up a vaccine. It's pretty well documented that it's vaccine and that it's cold, needs to be maintained at a temperature. How often, every time a new vaccine comes to the market, you need to be trained. Routinely, it's yearly, but as we've probably all identified the last couple of months, there's been a new vaccine on the market every couple of weeks. So then you need to go in and be trained on what is that storage and handling. And what is it about? It's about that whole, from the minute it lands in your office until you administer it, what temperature does it need to be stored at? How do you need to document it? Who else do you need to let know of the temperature? If you transport vaccine from one location to another to do an offsite event, which a lot of you may be doing for COVID, you also need to make sure that when you're transporting it and using it offsite, that it maintains the appropriate temperature.
Yeah, we do find that especially those of you who are newer to immunizations and doing these mass immunizations, we know you're staffing up really rapidly and bringing new people on. So having a really reliable system to make sure everyone who's going to be near that vaccine knows the appropriate storage and handling protocols is so critical. It really is important, and we know it's a lot of work to think through how to make sure of that, but you need it.
And it's also by making sure that at each stage, if you're doing a mass COVID vaccine event, that at the point where vaccines are being drawn up, that all those folks doing that know what the temperature of the vaccine needs to be maintained at. Those administering vaccine knows that what is room temperature and how long can it be at room temperature. I mean, those are job action aids and sheets that you should have at each one of those locations so that everyone knows.
Macrina, getting back to this slide, so back to our cold chain, when the UPS delivers, does the delivery person need to be in the office when they do their verification of the temps?
Oh, so does the delivery guy, like the UPS or FedEx guy, need to be there when you open vaccine and verify that the temperature is accurate?
Yeah.
No, they don't. Their job is to make sure that the package says vaccine, keep frozen or keep refrigerated. The most important thing with the FedEx and the UPS person is to understand that that vaccine can't sit on the truck overnight. If they're unable to deliver to your facility on that day, then there needs to be a process to either notify you or get that vaccine back to the distributor. Like many other deliveries that can sit on the truck for a couple of days, vaccine is not one of them.
But when the vaccine gets put on your counter by the UPS driver, that becomes your responsibility. So, and checking those temps, so they don't have to be in there in the office. They could have left, but as soon as it gets sat on that counter, it's your responsibility. And cannot tell you how many times we have heard stories of vaccine getting put on that counter and never leaving that counter until the next week, the next Monday after an office was closed for 3 days. So making sure who can accept those shipments. Some offices will have protocols that only certain people can accept those shipments because they know that they're trained to know how to get them right into the correct freezer or fridge and in the right order, and making sure that the old ones are up front in that fridge and get used first. But
yeah, the most common one that we hear about is the delivery gets made. The person whose responsibility it is to open it, unpack it, and put it away is at lunch. And so it gets placed underneath the counter. And then you just get busy and you forget that it's underneath that counter, and then somebody finds it a couple of days later.
Yeah.
So never put the package under the counter. Put it someplace where someone is going to see it, like on your provider's desk.
Yeah.
In their office.
And it's interesting that we haven't been seeing as many, we're not hearing a lot of this about the COVID vaccine, probably because everyone's just sitting there patiently waiting for it. But as we get more supply, those errors will start happening. The COVID shipments will become old news to your office. So make sure that you have those protocols in place now. So can you talk a little bit about emergencies and preparing for emergencies?
So you need to really have a plan in place, because what happens if your unit malfunctions and breaks? What happens if you lose electricity? Someone hits an electrical pole? I mean, there's all sorts of reasons why why you would lose electricity. Especially monsoons are coming here pretty soon. It's going to be down here in the valley, it's going to be incredibly hot, and then you have those kind of rolling moments where you lose electricity for 15 to 20 minutes, which is usually not a big deal. Because when you lose it for 2 to 4 hours, then it becomes a big deal. So you really want to have a plan on where can you move this vaccine? Who can be your partner in your emergency vaccine storage? And also keep in mind that a lot of you in some county and in smaller counties, even in Maricopa, right now we have so much vaccine in our units. We don't have the resource to be the backup for the providers within Maricopa County. So find your partner where you can actually make sure you have cold storage units that you can pack vaccine in to move, that you have vehicles to transport it. Remember, you never put vaccine in the trunk or in the back of a pickup. You're always going to put it in the cab or in the back seat or front seat. And just find a clinic that can that you can partner with to help, and each of you be each other's backups.
Yeah, I think that this not being able to use the county and for some of our rural hospitals too, just keep in your mind that a lot of your providers or partners who are administering thousands of doses have full freezers and fridges. So if they were your emergency plan, you need to check with them to make sure you can. So we are getting a comment in there. I thought we can't transport vaccine. So that is accurate for VFC. So for VFC vaccine, you cannot transport that vaccine. For COVID-19 vaccine, most of our events are being held off-site. So, last weekend there was a big event for transit workers and postal workers at a high school. The vaccine wasn't shipped to the high school, it was shipped to a pharmacy, and the pharmacy transported it to that high school.
Right. So right now, because vaccine is really limited, and because we really are dependent on these large pods or large administration sites, vaccine is allowed to be taken off-site and used at other locations.
Yeah.
That may change. COVID vaccine only. This may change once we get enough vaccine and every provider can have what they want in their own office. Those rules may actually backtrack to not taking vaccine off-site. So just kind of pay attention to the rules because they're going to be changing probably.
All right, so we have a poll here that we'd love everybody to take, and I'm going to launch it. So we're curious, what are the storage and handling errors that you have seen? And we'll give you a couple seconds to read all of those. You can check all of these ones that you have seen. And Macrina would check all of them. So it's okay.
Yeah.
We used to have a picture of a vaccine fridge that had like lunches and a wine bottle in there. But that was from many, many years ago. So
many years ago.
I'm sure those people are all retired by now.
That picture really tells a story.
Yeah. No wine next to the vaccines. And we'll give you just another 10 seconds here. All right. And I'll share the results. So we already talked about leaving them on the counter. I actually, I haven't heard that for COVID, but we've heard that, well, maybe I heard one story where that happened, but only for for an hour or so. Designating only one person to be responsible for storage and handling is the most popular error that you all have seen. Everybody really needs to know everything about all those vaccines and what you have to do. Things that belong in the freezer showing up in the fridge. Do you still see that a lot, Macrina?
Occasionally, but not as much as we have in the past.
Yeah, the documenting out of range temperatures on those logs, but not actually doing anything about it is super common.
That is probably the most common one we see, is that you're documenting your refrigerator temperature at 52 degrees for like a month and not recognizing that that's out of range.
And then what happens when you finally catch that?
Well, then you have to call ADHS and then you have to let them know that this is what happened. And in some cases, depending on the amount of time, your lot number could change. There's so many different things, and different vaccines are handled differently. So probably the last time you want to hear about it is when you actually place your order. Send a copy of your temperature logs to ADHS, and then find out that you can't get any more vaccine because your refrigerator was out of range. And probably the worst thing that could happen is that you have to recall patients.
Yeah.
Pick up the phone and call them and tell them what happened, and they need to come in for additional doses.
And for these COVID clinics, I mean, you're talking about calling 2,000 people back saying you need to come back in for a vaccine. Plus, it's so precious. All vaccine is really precious. As for many of you who've been in this immunization game a long time, shortages happen all the time. I mean, how long did you wait for your Shingrix, Macrina?
I probably waited 6 months, and then I got really panicky because I wanted to get my second dose.
Yeah, so shortages happen, and they happen all the time. So Bailey's saying she's seen inappropriate sized fridge storing vaccines with lab samples. Yeah.
Mm-hmm.
And then there's all sorts of mistakes that can happen. So, but it's not bad as long as you actually fix it. So, I do.
Hello? Can you hear me?
Yes.
Hi, sorry. I'm having trouble with my phone and the Zoom muting and unmuting. I had a quick question about the storage and handling. So my name is Victoria, and I work for a primary care office in Tempe. And when we were preparing our plan, emergency plans and stuff like that, I called the Arizona Department of Health to confirm whether or not we needed to have a backup site to transport the vaccine in any case. And I was told we did not need to have a backup site, that if the vaccines, for whatever reason, came out of temperature range, we would just call ASIIS, and they would tell us what to do with them. But we were not supposed to transport them. Is it different from primary clinics, different from the pharmacies and other facilities?
That would be news to me. I've always thought that ADHS required that you have an emergency backup plan in case during normal business hours you lost electricity or your unit broke down. Yeah, so I think we might want to get clarification from ADHS on that.
Yeah, we'll be sure to get clarification. I think if it's not, so if there's a temperature excursion for any reason, including a power outage, the first thing you always do, whether with any vaccine, is to call ADHS, and they will, walk you through what those next steps are. You also want to make sure that you keep that fridge shut, put a big giant, sign on it that says "Do not open." It's no different than your own personal freezer at home. You don't want to be opening and closing that all the time when you have no power. They'll walk you through those steps, but we do need to check on whether it's a requirement with COVID vaccine to have an emergency plan. Even if it's not a requirement, it's going to be a best practice. You want to be able to try and save that vaccine. And if you can't keep it at the right temperature because you're not getting power back, you're going to want to be able to figure out what to do with it with approval from DHS. So we'll get clarification, Victoria, for next week.
Thank you.
Yeah. And Bailey's asking if you have multiple sites, could you use another site as a backup? Yeah, absolutely.
Sure. Yeah. Mm-hmm.
So we're going to transition now into the storage and handling of the different COVID-19 vaccines. So for Pfizer, the state is administering Pfizer vaccine right now. So none of you should probably be getting Pfizer unless you're a pharmacy right now and getting it from the federal program. And I don't even think that FQs are getting it from the federal program, the Pfizer doses right now. So We're not going to go over Pfizer because we just don't think that any of you are administering it right now. You may be administering it again or for the first time in the future as we get more vaccine, coming into the state. If we do, we'll make sure they give you a refresher course on that storage and handling for Pfizer. Anything else on this, Macrina?
No, again, I think as vaccine becomes more readily available and we're able to get immunized and our private providers can get vaccine, we'll probably be seeing Pfizer, but not for a while.
And we did get a question that came in on that evaluation last time about whether they need to buy fridges or freezers.
Oh, definitely not. I would not, in anticipation of getting Pfizer in the future, buy a ultra cold unit. Pfizer at the end of February just changed some of their storage and handling, which said that you could actually store Pfizer for 2 weeks at your regular freezer temperature. So I think things might change by the time it gets to the point where Pfizer may be in every office. So hold tight, don't buy an ultra cold freezer.
Yeah, but you may be likely to see Moderna. So tell us about Moderna.
Well, you're definitely probably likely to see Moderna. It's a multi-dose vial. It's 10 doses per vial, and there are 10 vials per box. So the minimum order is 100 doses. The dosage is 0.5 mils, which is easy to remember because most vaccines are all 0.5 mils. It's going to arrive frozen, -13 to 5 Fahrenheit. You're going to thaw it before you administer it, either in the refrigerator or at room temperature. In the refrigerator, once it's defrosted and you have not punctured the vial, it's good for up to 30 days. So make sure that once you put the box in the refrigerator that you document the date, because you have 30 days past that to use it. If you do it at room temperature, which is again between 46 and 77 degrees Fahrenheit, it can be on the table for up to 12 hours. Again, if it's unpunctured. You never want to refreeze any thawed vaccine. And because this vaccine has absolutely no preservatives, once you puncture the vial, you must use it within 6 hours. That's very important. So make sure that when you do puncture the vial, if you're not doing a mass immunization event where you are assured to use those 10 doses, make sure you document the time that the vial is punctured. This is also why when you hear people administering Moderna vaccine, that they actually have a list of on-call folks who can be to your location within 15 to 30 minutes, is because you don't want to waste any doses. So as you get closer to that 6 hours, you want to make sure you have arms to put it in. You're muted, Rebecca.
You just wanted
You did it.
Yeah. A lot of offices are using those wait lists, and folks who are doing, and they're managing that themselves, the vaccine provider, because the vaccine provider doesn't want to waste doses. So they contact patients who, we prefer, and most providers are preferring that you stick as close as you can to those eligible populations right now. So right now in Arizona, we're focusing on people over 55 years of age and our frontline workers, including school and childcare and our healthcare professionals. But if you have extra doses, you just want to make sure that you're going to get rid of them. So we had an event last week that I was part of where they knew they had punctured some vials. So they knew they were going to have 10 or 11 extra doses. And they called the restaurants that were around there, and they were there in 15 minutes. They had them all of their workers go down there and get that vaccine. So, you think about your partners and where those community events are at. I think you said as soon as you puncture that vial, you write the time down, right?
You write the time down. As soon as you puncture the vial, definitely write it down. If you have volunteers, this is a great way to make sure that volunteers who are helping you out in your events or your clinics actually can get vaccinated. Keep them till the end of the day.
Yes. Yeah. Vaccinate them at the end of their last shift, at the end of the shift. Yeah, and be careful not to guarantee those. You want to make sure that plan for it if you're using that as a way to recruit volunteers, but you can't puncture a vial to do one volunteer if you don't
Right.
have a way to get rid of those other 9 doses. We have a question on here. Is everybody getting 11 or sometimes even 12 doses per vial of Moderna? We are finding that. CDC, and Jennifer is going to chat something in if she didn't already. CDC just asked us to remind everyone that FDA only has approved Pfizer at this time to use those extra doses, and we are going to get clarification about what that means. But yes, everybody's getting 11 or sometimes 12 out of those vials.
Yeah. With Moderna, it's probably about a 50-50. Sometimes you're getting 11, sometimes you're getting 10. It also depends on the person prepping the vaccine. I have a coworker who can get 11 out of every single vial. So
Magic hands.
yeah, it just depends.
Macrina, how long does it take to thaw it out in the fridge?
About 6 hours, 4 to 6 hours.
And what if a patient gets the vaccine before it's thawed out?
You know what? I don't know, because if it's not defrosted, you really can't draw it up. Because it is solid.
Okay.
So definitely wait till it's totally thawed before you start drawing up. Yes, and I've heard some places say that they've gotten some vials where they've only gotten 8 or 9 doses, as well as some people getting 11. Just make sure you document that when you have a vial that has less doses.
Yeah, somebody is chatting in. We've had them where we only got 8 doses. And Moderna, remember, it's a 2-dose series. It's separated by 28 days or 4 weeks. There is a 4-day grace period, so it'll count if it's 4 days for Moderna, and this is for patients 18 years and older. Oh, and that's chatting in. They've figured out that how many doses you get out is depending on this syringe and the needle being used.
That's what my staff have discovered as well.
And how long does it thaws out? 6 hours in the fridge. How long does it take to thaw out at room temp?
Usually takes about 30 to 40 minutes.
Okay. All right. And here is a link that we will be sure to chat in and send out afterwards for more information on the Moderna shot, and keep chatting in those questions. We'll have time for Q&A as well. We got this on our evaluation as well. So if a person received only 1 dose of the vaccine, they didn't come in until 3 months later, do they have to start the series again?
No. All data points to the fact these are just like any other vaccines. If you don't get the second dose, the minimum spacing for Moderna is 28 days. If it's 3 to 6 months later, you just go ahead and get that second dose and you're good to go.
All righty. And people are just crazy about not getting it within 28 days.
Oh yeah, that second dose is, I get more questions about the second dose than I do the first.
Have you started asking them when their last tetanus shot was due? Sure, probably due for that too. And we talked about the grace period. So we've been getting Johnson & Johnson for what, 3 weeks? We've had it in our communities in Arizona. So tell us about it.
Okay, so Janssen vaccine storage and handling, it actually comes in a multi-dose vial as well. It is 5 doses per vial. So it does make it a little bit easier when you're trying to get those last doses used. It's 50 doses per box, but you can still, the minimum order is 100 doses. You can't order it in 50 dose increments. The dosage is again 0.5 mils, which is routine vaccines for most folks, for most vaccines. It does arrive refrigerated at 36 to 46. And just like Moderna and just like Pfizer, Janssen vaccine is very gentle. It does not like to be agitated. It does not like to be made angry. You just gently swirl it, just like that, in your hands, or you just do this. Don't shake it. Just like the other vaccines, once it's punctured, you have to use it in 6 hours because it has absolutely no preservatives as well. And again, being a 5-dose vial makes it a little bit easier to manage. 2 hours if it's at room temperature, which is up to 77 degrees Fahrenheit. And with this vaccine, we have not noticed any additional doses. Now, granted, we have only been using it for a very short period of time, but it says 5 doses and we're getting 5 doses.
You know, we're getting a ton of people calling, wanting the Johnson & Johnson vaccine, the Janssen vaccine. So as much as you can, and we know that whether you are currently administering vaccine or not, your patients are calling you for help to answer questions too. We need to tell patients to get the first vaccine that is available to them. Don't wait for the Johnson & Johnson single dose vaccine. If you can get Moderna, get in line for Moderna right now, and you'll be able to get your second dose. We really need to help people not kind of vaccine shop as much as they can while supply is so limited. So
yes, once you have an unpunctured, well, I wouldn't recommend that you keep an unpunctured vial sitting on a countertop. Keep it in the refrigerator until you're ready to puncture and use it. But once it is on the table, you can put it back in the refrigerator as long as that time is still within that time. Both vaccines are IM injection. You're going to use 1 inch to 1.5 inch needle, depending on size of that deltoid for both Janssen and Moderna. Janssen is a single dose, and Moderna is 2 doses separated by 4 weeks or 28 days. There is a 4-day grace period, so you can give it as early as 24 days. And then there is no maximum time frame. And there's a screening, the screening tool for both vaccines are the same. So you're going to go ahead and use those same screening tools. Waiting 15 minutes for to be monitored is the same for both vaccines. If you have a severe allergic reaction to anything, if you carry an EpiPen, the recommendation is you wait for 30 minutes. And so that still remains the same for both of them.
and here's your info on the Johnson & Johnson Janssen vaccine.
Anything you want to know about Janssen, you're going to find at this site.
So anybody else have other questions around storage and handling? Well, feel free to chat them in too if they pop up. I know that we do have Maggie Macias is on the line right now, right, Maggie? Are you there?
Yes, I'm here.
All right. So if you have ASIIS questions, you can unmute your line or chat them in. And before you logged on, Maggie, we did get one. What are the vaccine abbreviations for the COVID vaccines in ASIIS?
The COVID vaccine abbreviations and ASIIS.
Yeah.
Let me just go directly to that.
Yeah, I don't think there is any, I mean, it says COVID-19 and then it gives you a very long.
Right. It says it just says Pfizer COVID-19 vaccine. That's pretty much it. And then Moderna COVID-19 vaccine. The abbreviation, if they mean more like HL7 or directly in ASIIS, it's just the vaccine name, Janssen COVID-19 vaccine. If they mean HL7, then it's for Janssen, it's JSN. For Moderna, it's MOD. And for Pfizer, it's PFR.
Right.
And this is Jennifer. I put the link to the full CVX codes and abbreviations for ASIIS if you're doing that HL7 and trying to get your EHR set up that way. But you have to make sure in your patient template where you typically would pick this is a VFC eligible patient or this is a private purchase patient, you also have to have that PAN designation for the funding source. so that it knows that it's a COVID vaccine and it's federally supplied.
Anybody else have questions or things that
Yeah.
you're wrestling through related to ASIIS?
Yeah, my name's Irfan. I work with Curative Medical Associates, and we're going live next week with vaccines. We were talking to a gentleman called Roger Akins, and for some reason I can't get in touch with him anymore. We were trying to just still test the HL7 so we could go into production. I was wondering, is there another contact we can reach out to?
Yes, that would be me. Roger actually retired 2 weeks ago, so right now I will be your point of contact. Jennifer, if you can provide him the email to ASIIS Group 1, that would be very helpful. And you can just ask me any questions directly to that email.
Sounds great. Thank you very much. Appreciate
You're welcome.
Anybody else have ASIIS stuff? Or other stuff? Oh, we're easy today.
Hello.
Yes.
Hi. I did a request to add a new fridge, and do you know how long does it takes? Because our new space that we designated in the clinic, it's ready to go. We just need the approval to add a new fridge, and I sent the pictures, calibration report, temperatures, and everything, but I haven't received any update.
Hi, Maribel. I will go ahead and follow up again with the IPS that's actually working your onboarding. I have your contact information and I will follow up with her.
All right, thank you.
You're welcome.
There's a question in the chat, Macrina, saying, how much help will we need for a vaccine clinic giving out 500 vaccines? How would you help them think through that?
Okay, so what I would think about is, if you're going to be making appointments, and how long is your day going to be? I mean, you need to know how many of those 500 you want to get done. Is it going to be 6 hours, 3 hours, 4 hours? That really is dependent on how many staff you need. And just remember that probably what you're going to need is, for every one person who's vaccinating, you are probably going to need 2 to 3 people to work them through the process, because you need to check them in, you need to give them all the paperwork, make sure they fill out all the consent forms correctly, review the screening, fill out the record card. Actually giving the vaccine is the easiest piece, and then you need someone who can monitor for 15 minutes if this is COVID vaccine. So again, it just all depends on how long your time is, what your length of time is. I would say if you have 3 to 5 vaccinators, which means you probably need easily 15 folks to help support those vaccinators. You could use volunteer pharmacists to do the vaccine prepping, and then you probably need 1 or 2 of those folks. But it's hard not knowing the length of time.
Mm-hmm. I think, for 500, depending on how many vaccinators that you have. I mean, if this is a drive-through clinic and you have 10 lanes, 500 can get done in probably 2 hours. But,
right.
But if it's in an office setting and you have, 2 or 3 immunizers, it'll be a 9 to 5.
Oh yeah, if you're going to do right here 8 to 5, if you're going to do 8 to 5, you could get by with probably 2 vaccinators and 5 to 8 helpers.
Yeah. Somebody's private messaging me too, saying that's what we do about 9 to 4. We do 2 people at registration, 2 nurses with 2 volunteers at the injection station, 2 providers with 1 volunteer at the observation station.
Yep.
So, also we have done some trainings before on setting up mass immunization events for medics. And we can make sure to put the link to that in the chat or send it out afterwards. It might be other recordings that it might be a little bit outdated and it's more geared towards flu, but it might be helpful for you to just watch and to think about what to think about. So we also had a request come in on our evaluation from someone who would love to come tour a pod, who's going to be starting to do pods. So if you are doing a pod or any kind of a mass immunization event and you're willing to have one of your colleagues come and just kind of shadow people around so they can plan theirs, please put that offer of partnership in the chat box so that person can see it. For uninsured populations, are you still recommending the UHC Optum option, or has an easier process been set up for billing admin fees? I think we still have to use Optum, right, Jennifer?
Yes, we do. And I was just typing that in. You do have to use the Optum system. I know it's kind of cumbersome. I'll put the registration link in for those of you who are not registered. You do have to register beforehand as a provider, and then you can begin to submit claims. And it's kind of complex because they give you a number, a temporary patient number, that you then have to get that, and then you have to take that back, build your claim, and then resubmit the claim. It is cumbersome, but the payments do come through eventually.
And lots of people are saying they would also like to tour. You don't have any pods that people could come look at, do you, Macrina, coming up?
They're all handled a little bit differently. I don't think, I think we do have some. People if you just send the information to me, then I will send it out to our planners and our outreach folks and just see what we have going. We have so much going and so much planned in April. I think we could find just something to tour.
Mm-hmm. See, it's much easier to just ask when you're right here. Now it's recorded, but you can't bring everyone, but you can bring a few people. And Amy's saying they don't have a pod, but they're using meeting rooms for large volume. That I think a lot of our FQs are doing similar things. So, and thanks for offering for people to come see that. That's going to be really helpful for your private offices too. Any other questions or things?
Rebecca, it's Jennifer. I just want to mention that we're putting together a very informal work group, or an informal kind of buddy system. So we're trying to match people who use specific EHRs to help troubleshoot EHR reporting to ASIIS. So I put a link in the chat if you want help troubleshooting your EHR, or if you've got this system down and you can help someone else, please follow the link and volunteer.
And Jennifer, if they are not submitting for reimbursement, do they need an Optum account?
No, that's only if you plan to submit for reimbursement for any patient that is uninsured. That's through Optum. If you're submitting reimbursement through Medicare, you send it directly to Medicare, not to the Advantage plan, uninsured to Optum, and then you use your access plans and your private plans for any insured patients.
I have a question in regards to the Optum.
Yeah.
So if we're already contracted and in network with Optum, and we already currently submit claims to Optum, is it any different submitting for an uninsured for COVID?
It is. It's a different process. You submit that you have an uninsured patient. They assign you a patient ID number, which would be almost like your health plan or group number. They give you one, then you go back, add that number to the claim that you've built, and then you submit the claim to them. So it's a tiny bit different. And if you need any help with that, then just reach out to me. I'll put my email address in, and I'll get our billing person who's really working closely with Optum to reach out to you for some details.
Perfect. Thank you.
And next week, we're going to talk all about billing. And Jennifer, as you said that, I thought, oh, we should probably make sure David or Patty is logged on to this too. The billing. Jennifer knows a lot about billing, but the technical stuff, there's some other people in her office that do things too. So, but yeah, next week's going to be all about billing. So be sure to make sure your practice manager or whoever does a lot of your billing knows about it. Sign them up for next week. They don't have to come every week, but next week will be an important one. Any other questions or things? We're going to launch. So next week, we're going to talk about billing. And then the following week, we still don't know what we want to talk about. So please see this poll and select whichever. You can select more than one of these options, but what do you want to talk about on March 25th? And we'll give you a little bit of time. Still coming in. It looks like a lot of people are saying immunizing in the office setting. If you are already immunizing in the office setting, and I know Amy, we might call on some of you all to just come prepared to say, you know, what works, how many are you doing? Just share your experiences. Like, are you allowing walk-ins? Is it appointment only? Do you block out every Wednesday afternoon for this? How many patients can you get in with shot-only visits per week? What workflow considerations do you have to have? We might ask you to just kind of not prepare anything formal, but talk a little bit. Because we actually do not work in a private practice or in an office. So we are really not the experts in that. You all are. So if you're willing to talk about it, please chat it into so we can contact you. Pods, we know a lot about.
Got a great list of lessons learned, is what I call it, and opportunities for anyone who's starting out. So we'll jot some things together, and if possible, probably put a slide or two together just to share the knowledge.
That would be awesome. Yeah. Thank you. Yeah, I'm wondering if we do the office settings kind of separate from pods. We can talk about pods till we're blue in the face. But, all right, so we'll keep the line open just for a little bit to see if other people have questions that you want answered. We will chat in there and email you a quick evaluation. It's just 2 questions. We are using it to make sure that we plan the next week's session. So, and email us if we can help with anything else. And remember, this week, when you think of something and say, man, I need the answer to that, write it down and then bring it next Thursday at noon. And you can ask that in that open forum. So thank you all for what you're doing. And thanks, Macrina. We haven't seen you on any of these yet.
I know. I kind of miss doing them. They're fun.
Yeah. You've been busy immunizing.
Yeah. It's fun though, because I get to immunize a population that I don't normally work with, you know? Normally I'm kids and young adults, and now I'm out there with all these fun, 75 plusers.
Yeah.
A hoot.
Yeah, she's spending lots of time in long-term care facilities.
Yeah, their stories are incredible. and they all want a hug. I think that's the toughest part is you can't hug.
Yep. Maybe we don't have questions. If anybody has questions, chat them in or unmute. All right, I think we're probably good to log off and see everybody next week. So thank you everyone for joining us, and we will see you next week.
Thank you. Bye.
Thank you guys.